This will be a quick tutorial over some anatomical line drawings. The first being the femoral triangle in the anteromedial thigh, the popliteal fossa, which is in the posterior knee, and it's appropriate if we bring up the popliteal fossa to also mention the branches of the sciatic nerve on the way down the posterior thigh into the leg. So first off, the femoral triangle, we can represent a relatively long muscle known as the sartorius with this long diagonally shaped line here. That's from the anterior compartment of the thigh. You have the adductor longus, which is a muscle of the medial thigh. And then ultimately we complete our triangle superiorly with the inguinal ligament, a line representing the inguinal ligament. There are three contents in this femoral triangle, in your anteromedial thigh. There's a blue structure here representing a vein, a red line representing an artery, and then a yellow representing a nerve. We also have a superficial vein coming up from the medial foot, leg, and thigh that will connect to the vein inside of the femoral triangle, this greater saphenous vein, as we'll talk about. So the contents from medial to lateral, notice the M and the L reference here at the lower right and left side of the drawing. From medial to lateral, femoral vein, femoral artery, femoral nerve. So a common phrase is the van drives out, right? The van drives laterally, so from medial to lateral. We have the muscular boundaries, S representing sartorius laterally, A representing adductor longus medially, and again adductor longus is part of the medial thigh compartment, and the inguinal ligament superiorly. One note, again, is that femoral vein is a deep vein coursing with its artery. The greater saphenous vein, which does not course with a named artery, will connect to it, right? It'll connect to that femoral vein. So this is a superficial vein, the greater saphenous vein, connecting to a deep vein, returning its blood so that it can continue back towards the heart. So greater saphenous connects to the femoral vein. Next, we have the popliteal fossa. The popliteal fossa is in the posterior knee. It's a region bounded by muscles, and we can represent these muscles with a diamond-shaped structure. Within this muscular bound area, we have an opening. It's really an opening through a muscle called the adductor hiatus, a hiatus being a sort of a gap in this muscle's attachment. And that's going to allow an artery and a vein to pass through. And so this is the same artery and vein that we just drew in the femoral triangle. When it was in the femoral triangle, the artery was known as femoral artery, and the vein was known as femoral vein. Now that they have passed through the hiatus, we'll talk about the popliteal artery in red and the popliteal vein. Again, this dashed line representing a posterior structure now, because after it passed through the adductor hiatus, it is now in a posterior location. We also have the sciatic nerve, which will come into the popliteal fossa from the gluteal region. So this was already posterior. It does not need to pass through the adductor hiatus, and it'll split into two other nerves before reaching the leg. Much like the greater saphenous in the femoral triangle connected to the femoral vein, the lesser saphenous in the popliteal fossa will connect to the popliteal vein. So if we add everything back, keep in mind the muscular boundaries include the semis, so the semitendinosus and semimembranosus, and the biceps femoris superiorly. Okay, so biceps femoris is going to be superior and more lateral. Notice our M and L references now. And then we have gastrocnemius coming up from the leg, right? Coming up from the leg. Gastrocnemius has a medial head and a lateral head. The contents here are the popliteal artery in red, popliteal vein in blue, and then the two nerves, tibial nerve and common fibular nerve. They branched off of sciatic. Number one, they're a sciatic, and the lowercase a is tibial nerve. Notice it's a bit more medial compared to the common fibular nerve, which would be the most lateral content of the popliteal fossa. A key observation here is the artery instead of the vein is the most medial structure. If you recall, when the popliteal artery was in the front of the thigh, it was referred to as femoral. It was not the most medial content. The vein was. So by the time the artery and vein travel down here, pass through the adductor hiatus into this posterior area behind the knee, they actually switch locations in most presentations. So now it's popliteal artery that's most medial, then it's popliteal vein, and then the two nerves. So a quick way to remember this is no longer does the van drive out. Now aviation, AVNN in this case, aviation flies out. It's still proceeding medial to lateral, but the A is before the V. The artery is more medial compared to the vein when you are behind the knee, when their name is popliteal. Next, we have the sciatic nerve and its branches, and I feel that it's appropriate to describe the sciatic nerve or draw the sciatic nerve and its branches just after the popliteal fossa, because as you'll see, that popliteal fossa becomes this area where the sciatic nerve, in many cases, branches. And so we have this first triangle representing the piriformis muscle of the gluteal region. It's deep to gluteus maximus. That is where the sciatic nerve typically emerges into the region. So notice this dashed line here. As it proceeds halfway down, it's still posterior, so it would be behind the knee, and the popliteal fossa will split into two. The first continues into the posterior leg and into the plantar foot, into the bottom of the foot. The other, which is more lateral, will split again into a superficial fibular and a deep fibular. So it became two other fibulars, so it's the common fibular. So sciatic nerve will branch into one that stays posterior, which is the tibial nerve, and one that proceeds more laterally and then branches, that's called the common fibular. Let's continue with our landmarks. There's the popliteal fossa diamond once more. That is where the sciatic nerve often branches, not always, but often branches there. And then we also want to draw a little square to represent the place in which we can find Tom, Dick, and Harry. So again, you have your dashed lines and you have your solid lines in the previous drawing. Because this is a complicated drawing, we want to draw it all out as we label things. So even though everything's solid here, just pay attention to what we did before to really represent the posterior structures versus the ones that can be seen more anteriorly. So what we find is the piriformis muscles in the gluteal region. It's a nice relationship to find sciatic nerve. You have the popliteal fossa, and then you have in the posterior leg, where that tibial nerve is going, the Tom, Dick, and Harry muscles in the deep posterior leg. So the S represents sciatic nerve, and that'll split typically in the popliteal fossa into the tibial nerve, and that will continue into the plantar foot to give you medial plantar and lateral plantar. Now this is probably the one place where the nerve, called tibial nerve, is doing something similar to the artery, if you guys are studying that as well. The artery technically is called posterior tibial artery. It too goes to the bottom of the foot to give you a medial plantar artery and a lateral plantar artery. So this is probably the one time I think where the artery does something similar to this drawing today, the nerve. Almost everything else about this drawing is different than the arteries, so you should probably study them with that in mind. Common fibular nerve. Common fibular nerve ultimately will split into a superficial and a deep fibular. So if you go back to the drawing that we did, sciatic nerve would be dashed, so it's posterior. Tibial nerve would be dashed, so it's posterior. Common fibula would be dashed, so it's posterior. But when common fibula branches, as it's wrapping around the head and neck of the fibula, its distal branches, the superficial and deep, are seen more anterior. The deep fibula will innervate muscles in the anterior leg. The superficial will innervate muscles in the lateral leg, but then send cutaneous nerves to the front of the leg and the top of the foot. The ultimate destination of deep fibular nerve is the wedge between the first and second toe, so that skin between your first and second toe, from above though, right? From anterior onto the top of the foot. So when you draw those as solid lines, superficial and deep, it's kind of a clue as to where they're going to be providing nerve fibers to muscles, or maybe collecting nerve fibers from cutaneous structures, so on and so forth. So keep that in mind.